Good day, listeners. My name is Muhammad Abdullahi, and I am the presenting author of the abstract number 181. The title of my presentation is Emergence of Colistin Resistance Gene, MCR1, in Clinical Enterobacteriaceae Isolate in Abuja, Nigeria. Treatment failure, longer hospital stay, and death as a result of AMR is on the rise. As a matter of fact, there's been an academic estimate by the World Health Organization of a projected death rate at 10 million by the year 2050 as a result of antimicrobial resistance. There have also been an increasing spread of mobilized or plasmid-mediated resistance to colistin, a drug of last resort for the treatment of bacterial infection caused by multiple drug-resistant gram-negative bacteria, including carbapenem-resistant Enterobacteriaceae. This colistin resistance is not just peculiar to isolate of animal origin, but to the entire One Health, that is human, animal, and the environment. In Nigeria, only a handful of studies have described colistin resistance in isolate of both human and animal origin. Therefore, these studies is aimed at detecting the presence of MCR1 gene in multiple drug-resistant ESBL-producing clinical isolate of E. coli and Klebsiella pneumoniae from some selected hospitals in Abuja, Federal Capital, Nigeria. These hospitals are Garki Hospital, Abuja, and Nisa Hospital, Abuja. The objective of this study is to molecularly characterize ESBL-producing MCR1 gene harboring clinical isolate of E. coli and Klebsiella pneumoniae. A total of 115 sample size was arrived at using the sample size determination formula by Kadam and Valerio 2010. Therefore, a total of 115 suspected clinical isolates comprising of 60 E. coli and 25 Klebsiella pneumoniae from Garki Hospital, Abuja, and 17 E. coli, 13 Klebsiella pneumoniae from Nisa Hospital, Abuja, isolated from patients' urine and stool samples, were aseptically collected over a period of 3 months. The colonial morphology of the suspected isolate were macroscopically determined. Gram staining was carried out microscopically to differentiate gram-positive bacteria from negative. Biochemical tests were carried out using a microgen identification kit, which is a standardized biochemical substrate in microwells to identify the family of Enterobacteriaceae and other fastidious gram-negative bacilli according to the manual instruction. Modified Kepa-Biawe distribution method was employed to determine the antibiotic susceptibility pattern of the collected isolate to a panel of some selected antibiotics in accordance to the European Committee on Antimicrobial Susceptibility Testing, UCAST. MIC of colistin was determined by the broad microdilution method. The double-dig synergy test, DDST, was employed here in determining the phenotypic production of ESBL. Molecular detection of ESBL genes and MCR1 gene were carried out via polymerase chain reaction. The isolation rate in this study is at 43%. 73% of the test isolates were multiple drug resistant. Molecular analysis revealed that 60%, that's 3 out of the 5 of the ESBL analyzed isolates, harbored at least more than 2 ESBL genes. And finally, 13%, that's 1 out of the 8 analyzed isolates, harbored MCR1 gene. This study documents the first detection of MCR1 gene in multiple drug resistant clinical isolate of E. coli in Abuja, Nigeria.